Hello and welcome to UK Fitness Hub. My name's Travis and today we're going to be talking about medial epicondylitis, also known as golfer's elbow. Let's get into it. Let's get straight into it. So what is medial epicondylitis? Well, first things first, don't worry too much about the term golfer's elbow because it is a coined term. I've never actually treated any golfers with this condition, as of yet anyway. Now, medial means towards the midline of the body, and we've got a medial epicondyle and a lateral epicondyle. And if you take your hand and you run it on the inside of your forearm, when you get to the actual elbow, you'll notice this little knobbly point, sharp point of the elbow, and that is your medial epicondyle. If I bring my wrist into flexion, all of these flexor muscles in the forearm start to engage that help with that flexion of the actual wrist joint. Now, when these muscles engage, all of those actually attach to the medial epicondyle, and muscles attach to bone via tendons. Now, it's the tendon that gets sore, inflamed, irritated, or even in really bad cases that tears, and it's the muscles that get tight. So when we actually go into the stretches and exercises, we stretch the tight muscles, and then we strengthen the muscles to relieve the pain off the tendon. Now, why do we get this? Well, people that get this are often gym goers, and they overload the muscle, either with the amount of weight they're doing, poor form, or actually the velocity in which they do a movement. So let's take, for example, someone doing a tricep movement and they do it really quickly and rapidly, and they go from 0 to 100, it can create like a shearing pain on the actual tendons in the elbow. Somebody, for example, doing a baseball throw, so they've got a baseball, it doesn't weigh anything, but that velocity of the throw, again, can cause pain in the elbow. People can actually get this who do trade work. So for example, somebody that constantly uses the forearm and elbow joint a lot more than the usual person doing repetitive movements. Let's take somebody that constantly does hammering or somebody that constantly does screwing and unscrewing. They're going to be susceptible to pain in the actual joint of the elbow. Now let's get on to some of those stretches and exercises that we can do to start to relieve pain.
Your first protocol to speed up recovery is to start cold compressions. I would advise you do this 3 times daily, morning, afternoon and night, for 3 to 5 minutes. Using ice helps numb the pain and also causes blood vessels to narrow, bringing down inflammation and swelling. You should find as time goes on, pain eases. If, however, you are getting progressively worse, this would be your cue to seek a medical professional. Before we start stretching, we are going to go through 2 warm-up drills for the forearm. First off, place your arm outstretched in line with your shoulder, then begin to make a fist. In this position, bring your hands outstretched before returning back to making a fist. Repeat this for 15 repetitions, up to 2 sets over, ensuring all repetitions are slow and under control. Following on from our last warm-up exercise, keep the same position, however this time we are going to bring the wrist into flexion. Slowly drop the wrist down, keeping careful control of the movement before lifting slowly back up. Ensure the arm is completely in line with your shoulder and repeat for 10 repetitions up to 2 sets over. Moving on to stretching out those tight forearm flexor muscles, it all depends on how bad your injury is as to how much you can tolerate when it comes to stretching. For the lightest stretch, make a fist with your hand and place it wrist up against the wall. The next progression will be doing the same, but this time with a flat hand. Finally, for an even deeper stretch, you can take your hand off the wall entirely and pull back your fingers and palm with your free hand. Whatever stretch suits you, hold it for 30 seconds up to 3 times over and try to progress through these variations. If you've managed all those stretches perfectly, there's only one more further progression we can go on to. But this one can be very abrasive. Come onto a tabletop position on your knees, bring your hands in contact with the floor and your fingers pointing towards your knees. This stretch really prizes the forearm flexors apart, and if you feel any pain during this, you would stop immediately. This is also good post-rehab to throw in before or after workouts. Your next exercise is eccentric wrist drops. You can do this with either a resistance band, dumbbell, or a general object like a water bottle. Research has shown that eccentric exercises can be effective in treating and repairing tendons. Eccentric simply means the lowering phase of a movement. In this example, I only have my elbow on the bench, and I utilise the lowering phase only of the movement. This is why when I drop my wrist all the way down as far as possible, I use my free hand to bring it back up into an extension. Now repeat this 10 to 15 times, 3 sets over. Working eccentrically is far safer to rehabilitate tendons due to the fact the body can tolerate 1.75 times more weight eccentrically than it can concentrically. Once you've mastered eccentric wrist drops, you can move on to completing both parts of the movement. In this clip, I'm using a 1 kilo weight. However, I would actually start off clients on 1 pound. Remember, you can use household objects like a can to do this, and it doesn't have to be a dumbbell. Take great caution during the exercise to ensure that you are slowly executing both parts of the movement, especially the lowering phase. Make sure gravity isn't pulling the weight down and you're controlling it with your wrist really slowly. Picking a weight that's too heavy could set you back and end up being completely counterproductive. Finally, to finish, we have soft tissue mobilization. You can decide to use a small amount of oil, however, it's not mandatory. During this soft tissue mobilization, I take 1 or 2 fingers and begin to move the tissue from side to side. Think of this less as a rubbing technique and more that you're trying to create movement in the muscles. I glide my fingers side to side, and as I do this, you can see the tissue moving. Mobilization can break up scar tissue, adhesions, and promote blood flow, and in turn aid recovery. Massage for as long as required. Once you finish, however, give yourself a break from massage for at least 48 hours, and this is just to let the forearm settle down. Massaging and then doing a cold compression would be a good pairing.
So before I end off today's video, there's one topic that I'd like to speak about, which is arm supports for golfer's elbow and tennis elbow. And you'll notice I didn't actually mention it in any of those clips. So my take on them is that I wouldn't actually recommend them to 90% of the client base that come into my clinic. The reason for that is that they are maskers of pain and they are seen as quick fixes. Now, a lot of the time, people get lured into these products on sites like Amazon, where they've got loads of 5-star reviews. Some of them are fake when it comes to physio products because they are looking to sell as many of these as possible to a general populace. And clients will say to me, Travis, I've bought this brace. And I'll go, oh. And the reason for that is I generally like to teach the rehabilitation of, here's the root cause of the problem, let's fix that, let's not go for any quick fixes. Now, when it comes to rehabilitating, you need to be icing, stretching, and developing the strength in the muscles, not wearing a brace. A brace is like a last resort for somebody that has to work and they're self-employed maybe, they're in a trade, and they have no option but to work through pain. Somebody like that would benefit from a brace and they can wear that to go to work, but it is seen as like a last resort for me. Now, for the general populace, they can take the time to rehabilitate themselves in the right way. So if you're watching this and you have to work, you're in crippling pain, go to a doctor, and you can also maybe think about buying a brace. For the general populace though, focus on your corrective exercises. Now, that concludes the end of today's video. Thank you very much for watching. And if you have gained something from this video or you've liked it, then please like the video and subscribe to my channel for more physiotherapy-based content. I've been Travis Tarrant and you've been watching UK Fitness Hub.